good day. We are Group 5 and we are John Marshall Aldas, Micah Juliana Belonio, Kathleen Gaga, Daniel Sobehana, and Joanna Nicole Tanay. And we will be discussing the earthquake that happened in Bogo City, Cebu, where in Bogo City Provincial Hospital reached full capacity in wake of Cebu earthquake. According to a GMA news report, after a magnitude of 6.9 earthquake struck Bogo City, Cebu, and nearby towns on a Tuesday night, October 2, 2025, the Bogo City Provincial Hospital faced a serious problem. Hundreds of injured people rushed to the hospital and the medical staffs were overwhelmed. The hospital quickly reached full capacity, meaning there were no more beds or space left for the incoming patients. So in the article, Governor Pam Baricuatro said that they urgently needed help to transfer other patients sa ibang hospitals na may available facilities kasi hindi na talaga kaya ng Bogo City Provincial Hospital. And in this article, meron pong news video na naka-attach wherein we can see that there are cadaver bags placed beside the patients waiting outside the hospital. This shows how bad and chaotic the situation was. Kulang sa space, kulang sa gamit, at kulang sa tao. We can just imagine how traumatic that was for both the patients and the healthcare workers seeing injured people and deceased bodies side by side. Now, pag-usapan natin yung ethical or moral dilemma na involved sa situation na to. So, the main issue here was the lack of medical resources like hospital beds, medicines, equipments, and staff compared sa dami ng pasyente na kailangang gamutin dahil sa lindol. Because of this, the big question was how can doctors and nurses fairly decide who to treat first when resources are too limited to help everyone at once. This created a serious ethical conflict between two important principles. The first is the utilitarian principle, which means using the available resources to save the greatest number of lives possible. The second is the principle of individual care, which says that lahat ng patients ay dapat tratuhin fairly at bigyan ng equal chances makareceive ng treatment or ng tulong. Pero in a real-life emergency like what happened in Bogo City, it's almost impossible to follow both. The medical team had to make choices about who to prioritize even though we all know na every life matters. So, this situation became an ethical concern because it challenged two core values in healthcare. First is justice and fairness. Since yung mga resources are limited, hindi lahat naka-receive ng same level of care. Some patients were treated right away, while others had to wait longer, which led to unequal access to treatment. Pangalawa, yung beneficence and non-maleficence, which means doing good and avoiding harm. Sure naman tayo na lahat ng medical staff gustong tulungan lahat ng patients na dumadating sa hospital. But because of the capacity of the hospital, many patients were at risk of harm, more suffering, and even preventable death. The lack of space and supplies made it impossible to fully follow these principles. So that is all for my part. To continue this discussion, may I call on the next presenter?
Let us now discuss the natural law analysis.
Number 1, preservation of life or the rescuing of victims or even the transferring of victims to a less crowded hospital reflects the moral duty to protect and sustain life. So according to natural law, every human has a right to live, and both government agencies or us citizens are morally obligated to act on to preserve that life even during disasters or calamities. So next is the pursuit of truth and honesty. Government officials and media outlets such as GMA Regional TV provide accurate reports on casualties and damages. This practice fulfills the natural law to pursue truth, ensuring transparency and helping direct relief efforts effectively. And then lastly is the promotion of human dignity. Victims from individual families to displaced residents receive care and respect through assistance such as yung food packs or temporary shelter or even yung burial health and of course, emotional support. So natural law emphasizes that human dignity is inherent and must be respected regardless of the social status. So when resources are limited, the challenge is to treat all victims, of course, fairly and humanely as much as possible, demonstrating that compassion should be the foundation of every decision.
So, ngayon naman, na-explain ko naman yung pang-apat at pang-limang natural law analysis. Number 4 is the reason and responsibility. Actions like repairing hospitals, rebuilding roads, and organizing rescue operations shows the importance of rational decision-making and moral responsibility. Yung natural law, nagtuturo siya sa humans na mag-act accordingly to reason, not impulse, para makapag-restore ng order at mag-prevent ng further harm. During emergencies naman, responders face the dilemma of making quick yet thoughtful decisions that balance urgency with ethical care. Panglima naman, sa common good, all relief and recovery efforts from food distribution by the DSWD to infrastructure repair by the DPWH. It aims na mag-serve the collective welfare of affected communities. Natural law emphasizes working for the common good, ensuring that recovery plans benefit everyone rather than select groups. And also, in-state din dito na leaders must maintain fairness, unity, and focus sa mga communities, sa well-being ng communities over their personal or political interest.
So for this part, I will explain the relevance of the Baguio City earthquake to the nursing field and the lessons we can apply in our future practice. First, the incident shows that nurses have a strong ethical duty during disaster response. In Baguio City Provincial Hospital, staff faced a sudden surge of injured patients. Even if the hospital was full and the situation was overwhelming, nurses continued to provide a safe and compassionate care. This reminds us that in emergencies, we must protect patient safety and dignity no matter what, no matter how chaotic the environment becomes. Second, the event highlights our responsibility to practice fairness, good clinical judgment, and patient advocacy. Limited resources mean difficult decisions. Nurses must still prioritize patients properly, avoid discrimination, and speak for those who cannot advocate for themselves. Fairness and sound judgment become even more important when supplies and space are limited. Third, the case shows the value of professional integrity and teamwork. Earthquakes create high-pressure conditions, so nurses must work closely with doctors, emergency workers, and other staff. Staying calm, following protocols, and coordinating will help maintain quality care even under stress. For the lessons, this incident teaches us several key values. Ethical decisions making guides us when resources are scarce. Teamwork and communication improve coordination during crisis. Compassion and empathy must stay at the center of our actions because patients and families are under extreme fear and stress. Preparedness and resilience are also essential so we can respond effectively to mass casualty events. So overall, the Baguio City earthquakes shows how important nurses are during disasters and reinforces the ethical and professional values we need in our future practice.
So, ang natural law, it teaches us to do what is right and fair kahit anong sitwasyon, lalo na sa panahon ng sakuna. Halimbawa na lang is yung nagkaroon ng lindol sa Cebu, hindi lang ang mga rescuers ang kumilos, pati na rin yung mga ordinaryong tao. Sila ay tumulong magligtas ng kapitbahay nila, nagbigay ng pagkain, tubig, at kahit simpleng tulong gaya ng pagbibigay ng masisilungan. And ipinapakita nito na kahit sa gitna ng takot at gulo,
may natural goodness pa rin na makikita sa mga tao. Ganon din noong malakas na bagyo sa Cebu, kung saan maraming lugar ang binaha ng sobra at umaabot pa hanggang bubong. Maraming pamilya ang nawala ng tahanan at may mga pets at stray animals na naiwan, trap at namatay. Dito rin pumapasok ulit yung natural law na hindi lang tayo dapat magmalasakit sa kapwa-tao, kundi pati na rin sa mga hayop. Kung magiging responsable tayo, gaya ng maayos na pagtatapon ng basura at pagtulong sa mga nangangailangan, mas maiiwasan natin ang ganitong pangyayari sa susunod. Ibig sabihin, ang natural law ay hindi lang tungkol sa batas, kundi na rin sa pagiging makatao at mahabagin sa lahat ng nilalang.